Hey guys, and welcome back to SLT Time. This is episode 6, and today from the SLT Time team, we've got me, Ilya, we've got Mariam, we've got Sahar, and we've got Veronica. And we're joined today by our guest, Sarah.
Hi, my name is Sarah. I am currently working in an adult acute service, and I'm currently working with care of the elderly population.
Last week, we spoke about cultural competency, sort of how this was taught at university, the education around it. We had some students speaking about their experience. And kind of summarizing what the key points were was basically around the shocking lack of education, how maybe there was one lecture on bilingualism which was meant to encompass cultural competent working. Um, and we also had Sharon, who's about to start her teaching position in September, and she was talking about how she is going to implement cultural thinking into every aspect of her teaching, and that actually this can be done across all modules and throughout the course and into frameworks. So yeah, those were some really, really key points from last week. Um, we also discussed about not putting people into accessible files, such as like this is how an Arab family will react to this, and this is how an Asian person will do this, because that just sort of perpetuates stereotypical thinking. And instead, we want to really encourage students to ask questions throughout their practice, when they're information gathering, when they are rapport building, just really asking key questions from the get-go to get to know the client and the community that they're working in. We had some really great responses from last week's episode, so I'm just going to read out some of our tweets. Sorry if I say any names wrong, I'm dyslexic. Our first tweet is by Claudia O'Leary at Claudia O'Leary1. Sorry if I said your name wrong. So she said, always learn so much from listening to these podcasts. Interesting point about fostering self-reflection on our own culture before we understand other cultures. Cultural competency should be intertwined into all lectures and topics. One module isn't enough. Definitely. Thank you so much for that tweet. I think unanimously we agreed that there needs to be more input in a curriculum level. And then next, we've got a tweet by our fave gal, Nazia Rizwan, and that's at Nazia Rizwan SLT. She said, finally got round to listening to this. Her reflections are cultural competency is not an add on, it's integral to our way of working. Practically, it's not that difficult to embed within our practice, but can be if we never confronted with our own biases. Ways to incorporate are ask questions during case history around what they get up to, e.g., their interests, social activities, and their family life, and what activities are important for them. This helps you understand their personal culture and not the presumed culture you may think they fit into. What are they currently unable to do due to their speech, language, and communication need? How can you help them achieve this outcome? Finding out about their personal culture helps to ascertain this. Use this to then help inform your goal setting so it's functional and impactful. During a session or when planning, if you're not sure whether a resource will be culturally appropriate or not, it's okay to ask the client or carer. Have backups just in case, and if handled sensitively, it should help foster collaboration and inclusivity. I love that whole thread. It's really practical, exactly on point with everything that we were talking about last week, especially in terms of like adapting frameworks, for example. I think we mentioned last week about like ICF, if you're going to make functional goals, why can't it be something like or like participation goals, attending group prayer, if that's culturally relevant and important for that client. So yeah, thank you so much, Nazia. Next, we have a tweet by Dr. Ryan Soden at Ryan Soden, another important podcast from SLT Time, highlighting the need to give historical contextualizing information as part of cultural competency education and the importance of hearing from ethnically diverse people with communication difficulties during SLT training. Thanks. Um, yeah, so we got actually a lot of good feedback about the contextual introduction that we gave in last episode, about sort of the history of colonialism and migration and just sort of the demographic of the UK that we live in, which we're not given in the course, and a lot of people agreed that maybe that's something that needs to be touched upon at some point in our training. Thank you, Ryan. Next tweet by Paula Leslie, and that's at Prof. P. Leslie. Oh my, hot eyes this. Laughed out loud at pants. Brit SLT in the USA for 13 years. Always told students to not use the word with Britlanders. Critical self-reflection is crucial. We all have culture. I'd push for cultural humility / appreciation, not competence though. It's an evolving, lifelong process as opposed to a benchmark got it thing. Yes, to pedagogy changing, but it's not that new, surely. 25 years ago, I was taught to find out who my client was with the same cues these great speakers asked. My class in USA got learners to team up and present on a given culture. My class in USA got learners to team up and present on given culture, because culture takes lots of forms, then share history, geography, food, etc., and common features, including eye contact, and the same for standard Western American. Critical self-reflection. We all have culture. We must provide safe spaces. Exactly. Thank you so much, Paula. Okay, and lastly, by Katie Levi, at Katie Levi SLT. Finally caught up with the latest episode. Really liked the point around how we should all be encouraged to self-reflect on our culture, our views, our biases, and how they impact the way we view the world and how we interact with people. It's true that it's often not acknowledged that there is a white British culture too, probably because it tends to be seen as the norm, and all other cultures are, well, othered, so we aren't confronted with that level of self-reflection. Reminded me of an excellent Channel 4 documentary, The School That Tried to End Racism. All children were asked to bring in something that represented their culture, and the white pupils found it really difficult because they'd never had to have this awareness before. Which is sad because culture plays a huge part in our lives. As Ilya said, until we foster that level of self-reflection, you can't really understand others and how they view the world because you haven't even worked out which lens you're viewing yours in. Exactly. Thank you so much, Katie. That is really a great summary of kind of key points that we talked about. Also recommend that Channel 4 documentary. It was really, really interesting. Cool. So today we're just going to carry on that conversation and instead move it more into the workplace. What is in the workplace now? What isn't in the workplace now? And what can we do about it?
Okay, so to begin with, we thought it might be a good idea to just review what we mean by culture and culture competence, and then have a think about how we might see these in the workplace. So culture is essentially the values, norms, and traditions that affect how individuals of a particular group perceive, think, interact, behave, and make judgments about their world. And it's essentially how people make sense of what's happening around them and in the world around them. What's important to note is that the cultural process differs even within the same ethnic or social group, and we touched upon this briefly in the last episode. And this is because of differences in age cohort, in gender, in political association, class, religion, etc. So you might have people from the same, or what we would think are from the same culture, but actually their beliefs and what they would like is quite different from each other. And then moving on to what cultural competence is. So it's essentially having an understanding of how culture influences the way we think and act. And then in the context of speech and language therapy, it's having an understanding of how culture might affect someone's perception of what health is, what they prioritize in health, that relationship between the professional and the client or the patient. And so it's essentially taken into account people's cultural beliefs, behaviors, and needs when we're dealing with them. And we talked about three main things in the last episode. So having an awareness of our own culture that will help us understand others. Thinking about what our attitude is towards cultural differences, having acknowledging our own biases as such, unconscious or conscious biases, and having interest in understanding and developing our knowledge of different cultural practices with the clients or patients that we're working with. So we know that, the UK healthcare service, NHS and private, will aim to ensure that services is equal and is responsive to diverse needs of patients, and is culturally inclusive. But we also know that there's consistent reports of health inequalities, and that the UK healthcare system is actually struggling to meet the needs of our culturally diverse population. There's also evidence to suggest that the current cultural competency framework doesn't really prepare health professionals to meet the needs of culturally diverse communities. And I think it will be interesting to think about how or what sort of program might actually be more useful in the workplace, and how much cultural competency or cultural awareness is thought of in our current workplace. So what do you guys think? Is cultural competency something that's talked about at work, or what are the sort of pros and cons currently in the fields that we work in?
Well, in my workplace at the moment, I know before, recently, I've only been working for about a year, but kind of before everything happened with Black Lives Matter movement and everything, there wasn't really much that was discussed or talked about. It was kind of just taken as it's part of our everyday job. And I don't know what everyone else thinks, but I know what you guys touched on with it not being covered at uni, but even in the workplace, sometimes for example, a dysphagia competency, it feels sometimes a bit of a tick box, consider culture. It's never really explored or kind of talked about practically. But we were having quite a lot of conversations in our office about it, and kind of what we could do, which opened a bit more of a reflective space. But I think it kind of took that to open the space for it to become something that everyone would work on and think about. And then so many interesting points came up within that conversation, if that makes sense. But it almost needed someone to take the lead on that.
Yeah. And I think a lot of the research does suggest that it's a tick box exercise or a short training that you would do, but actually we come out of that not actually knowing how to put that into practice. And it's great, we all think it's something that we need to think about, but when we're doing an assessment, what do we need to think of? What type of questions do we need to ask? And then the same with therapy as well. It'll be interesting to hear what discussions and ideas you thought of in that sort of meeting, I guess. But I think that's a really good way of opening that discussion and just talking about it with colleagues at work.
I mean, a lot of the discussion was around kind of feeling confident to bring up those type of conversations in assessment or in therapy. But I think what was really interesting that kind of came out of it, that everyone kind of felt, was almost the assumption that if someone thinks it's important, they will bring it up. So the onus was on the patient to discuss or to bring it to kind of the space. Whereas actually, we know from research that's not often how it works, or there's that kind of power imbalance. They might think, oh, you're the healthcare professional, and if you don't invite me to speak about that, then I'm not going to bring it up because maybe you don't think it's important. So we had a lot of discussion about how actually all of us could make that change and have the onus on us to invite someone to speak about it or open that space for them. And I really liked what you were talking about last week about even just saying well, what do you do at the weekend, or what how do you find out what makes someone them? But culture is so central to everything we do in speech therapy. So not inviting that space, I think we're missing out on so many things we can do for our clients.
I completely agree actually about your point where sometimes we expect the client to tell us what is relevant, but actually we're the experts, and we are the experts on what we want to know, what information is important to speech and language and communication. So actually it's our job to really be able to ask the right questions in order to get that information from the clients.
Yeah, definitely. And I think it was Nadia who mentioned a few episodes ago about sometimes that we're brought up in a culture that has this almost complex about people of authority or people who are in professional positions, and how do you break down that barrier of making what's important to you known, when your whole sort of health literacy and your interactions with health systems is already sort of impacted by lots of historical context and your culture and everything. So yeah, I think it's a lot of people won't be comfortable bringing that, oh, actually I can't do this in my culture, or actually I need this sort of consideration. And then also tying into what people were saying about how important it is to acknowledge that there is a white British culture as well, and how we like accommodating, I mean, that's considered the norm, so how are we then incorporating that into whatever we're doing, kind of thing. So yeah, I think that onus again is put a lot of pressures on the clients.
I think also for me, like, I am a white woman, as a lot of, speech therapists are. And again, like, if I'm there I'm not asking those questions again to my clients that I'm not representing, they're probably not going to tell me about it, because they probably just think you don't understand, or, and so yeah, I think we need to take back some of that onus, I think. Definitely.
Yeah, no, I completely agree with what you've just said, Sarah. Like, it's the responsibility, and I think even just taking like 5-10 minutes of your assessment and your first meeting with the client and their family, and you can do that in pediatrics, with adults. It's something that you have to be really mindful of. And I think, like you said, in my trust as well, it's been the exact same. Like, everything that's happened recently, it's opened up these conversations, and it's taken that person, or that thing that you might have read, to spark that up. But I think it's definitely made us all have those chats about, okay, what are the practical solutions of what can we do with our resources? Like, can we diversify them? Can we make sure that we get some kind of tips from interpreters as well on cultural norms and things? So yeah, I think it's definitely always about responsibility, and not just kind of about cultural diversity, but about other areas of diversity too, and delving into how we can expand our own knowledge as therapists as well.
I think also this question just kind of came to me now about, yeah, okay, we're putting a lot of emphasis on asking the right type of questions, but maybe we'll talk about this in a future episode in a bit more detail, but a lot of maybe our parents or our grandparents' generation are dealing with a lot of traumatic racist experiences when they came to this country, and they don't want to talk about it. They're trying to assimilate as much as possible, and for you to be like, oh, is this all right for you guys, or how do you guys do this? They're like, oh, I don't want to think about it, I'm British, right? I mean, I'm just thinking from personal experience of family members that I know that they will try their hardest to come across as the norm that we've been taught when they go for these appointments. And so it's really sensitive, this type of discussion. Not that we shouldn't be having them, but I just think that there needs to be some sort of development of how to appropriately approach this. And I think that people won't be doing it effectively unless they're given a sort of training program, or a sort of framework or a guideline, which is like, for example, we're given a lot of like information gathering pro formas that we base a lot of our things on. That needs to be, I think, adapted now, to consider how to go about asking these questions, because yeah, it can be really positive, and the family and the client might feel really like they're being culturally like they're being considered in terms of their culture, but it could also go the other way, because when we're not addressing properly the like traumatic experiences that they have had in this country.
I think that what you just saying reminds me of also the issues with some cultural beliefs about certain conditions, and kind of like autism, or other kind of speech language and communication difficulties. There are certain things that in certain cultures it's seen as like kind of quite negative, and they kind of hide the children away rather than go and seek help. So I think, that's also a part of cultural competency as well, realizing that different cultures have different beliefs about the actual conditions and the needs of the clients, and, how to kind of discuss it with the clients and their families in order to make them understand that, it's not, you know, it's not something that they need to hide away, and maybe support them in you know, helping their children.
I think sorry, I don't want to go backwards, but just thinking about in therapy or in appointments and talking about well, let's say talking about religious things, for example, I can see how people would want to avoid that. And I had a session once with the autistic boy that I used to work with, and for example, he really wanted to go to Friday prayers. He really wanted to go to Jummah. So I was like, okay, he needs to be in school. He can't go to Friday prayers. So I could try a social story talking about prayers and what they are and when we go. But I actually felt really uncomfortable making that social story, because I don't want to come across as like I'm bringing religion into things. And because of experiences of what I've seen or heard, I don't want to come across in a certain way. But that was what was right for him. And at the end, I did make it, but I felt really uncomfortable making something like that. So I think it just goes back to normalizing things. So having those conversations in a way where it's normal, like it's not trying not to make it awkward. And I don't know what the right answer is for that.
No,
and
yeah, definitely.
Yeah, and I guess maybe talking about maybe like diagnosis as well, like Veronica was saying, like autism with parents as well, being able to create that safe space where they can say certain things, for example, not judged for it. Like I know sometimes I think a parent said to a therapist, oh yeah, you know, it's just a test from God, and we're going to and we're going to help him. And she mentioned it's a test from God, and that was seen as like a negative thing for her to say. Like, I don't know if I'm making sense.
No,
yeah. It's just something quite normal for me to hear. Like, if something doesn't go quite to plan, then yes, it's a test from God. But it doesn't mean that she thinks that autism is completely negative, if you know what I mean. But it's just having that understanding of the terms that are used, I guess, or her just translating an Islamic saying to English, and it doesn't sound quite right when you do that.
Yeah,
yeah, it's quite interesting actually what you're saying, Miriam, about you know, feeling bad about bringing religion into it. Why do you think you felt like that?
I just overthought things. I was like, I think it's weird because then I thought, actually, if I was a white therapist and I did that, there would be nothing wrong with it. But because I was a Muslim therapist with a headscarf talking about religion, I didn't want to seem like I was just always bringing religion into things.
No, exactly.
And I guess that's just me thinking of how people might perceive it in a negative light. Yeah.
But actually, I 100% agree, because I had a similar experience of one of my placements, and like ironically, it's something that can make a family feel really more comfortable and like really appreciative. For example, when I see like a Muslim, I was on placement and a Muslim family came into the clinic, and like, you know, like kind of when you want to give greetings, like a religious greeting, but you feel really awkward because it's not professional. But why? There's nothing unprofessional about greeting in my religious culture or in my language or whatever, right? But the mother of the child that came into this clinic didn't speak English, and I asked my practice educator if I could speak to them in my limited Arabic, just so that the mother understood kind of what the process was happening, because you could tell she was uncomfortable because she was so out of it, and like had no idea what was going on. And my practice educator said that wouldn't have been appropriate. But when I think about it now, I'm like, why? Like, I'm just trying to make this family feel more comfortable. Yeah, because they said that like I could translate, I could give wrong information or blah 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 blah.
So it's basically because your placement supervisor didn't understand Arabic, and they were probably, you know how there's this whole thing about monolinguals having this paranoia about bilingualism, right?
Yeah.
Because they don't understand what people are saying, and then they're like, oh my God, what if they're speaking about me? You know? So I think that was really bad that your supervisor done that. And I would say wherever possible, you should just use the languages that, you know, your client speaks. If you speak the language your client speaks or the client's parents speak, then you should definitely definitely use that, because I mean that's going to help a lot. I mean, if they can't speak English and you're trying to like talk English to them, you know, you're not going to get very
Yeah.
far, are you? So,
Yeah, and giving them some like English leaflets is not going to do anything for this. Like this, I was.
Yeah. And I think within that as well is like we you know, we know about using interpreters in sessions and as like a for translation, but I think going a step further and using them, so using interpreters to understand the family's culture or the patient's culture as well, like helps so much. We used to work, we had bilingual co-workers, so co-workers, they were speech and language therapy assistants that spoke the language of the majority, like the community that we were working in. It was majority speaking Bengali, and it was, so we had speech and language therapy assistants that spoke the language and also understood the culture, and they were able to come to the appointments with us and just see, you know, someone speaking their language and understanding the culture just helps them to build that sort of professional relationship so much more than I could have, for example. And then they, you know, using them to like plan sessions and assessments as well in terms of what's appropriate, what can we use instead of this, or and they can give us ideas and help us with that. So I think that's a really good way of including that in the work, but that's obviously dependent on if they're available in the trust that you're working, and budgets and so on. But yeah.
And they really help with making things accessible. So say if we're like going to send a 5-page report home and you know that the parent doesn't speak English, it's almost just like they're just already at a you know, an unfair, you know, level. So yeah, so using the interpreter to help with that, or and actually that's easier said than done, because I know that in my experience getting interpreters at certain times has been tricky, but actually it's just about persevering and making sure that everything you're sending home and giving to a family is accessible. And you know, there's a lot of resources out there. I know that there's a lot of translated like leaflets and resources, so it's just about spending a bit more time, I think, looking for things. And you know, I almost wish kind of in trusts there was this way to send out reports in another language, so it's just already done. That would
Auto translate.
I know.
I have another. I'm not sticking to our structure of questions at all, but I have just another question that came to my head. This is all really relevant for most of us who work in London in very multicultural and migrant communities. What do you think is the responsibility of people who work outside of London across the country in areas which maybe there is a complete white majority? Maybe they'll see one family from an ethnic minority like a term. What do you think their role and responsibility is in their development of cultural competency?
well, even if you've got one client, you still need to know how to work with that client, don't you? So you still got a responsibility to train and learn about cultural competency so that you can, you know, work properly with that client. You know, people can't be lazy just because they don't have a lot of, you know, minority ethnic clients on their caseload. You know, you've got responsibility to every single client that you work with.
Yeah. And I think it's, again, going back to that point of understanding British culture and what that means. And then also using resources, like I was thinking of, you know, collating some diverse resources or some resources that are different to what we're using now. And you would use that with everyone. You would use that, it doesn't matter if they're from an ethnic minority or whether they were white British. Then it's still relevant to make sure that people are seeing difference day to day, and it's the norm.
I was going to say as well, so a lot of the so I guess in a lot of the communities I go into, so I'm obviously community based, so I'll go into a lot of schools, and I would say like in a lot of them the majority are white British students, but also the staff as well. So it's like even more, like you were just saying, like even more responsibility in those communities that we are well equipped to work with, you know, even if it is just a majority white British caseload, we still need to make sure that we are doing extra work when we can and researching into different communities. And there is a lot of, I suppose, there is resources out there, but I think also we need to get better as collective groups of therapists as actually like putting things together. And I think that's something my trust is trying to do. So for different like communities, we're putting different resources together, almost like you were saying, like a framework of, because it needs to be really clear, I think
like even like further than resources, I completely agree with you, but I don't know, like when I've tried to do like research or like see like what's out there, like I'm sure you guys have also found this too, there's really nothing there, like, or limited, or the stuff that is there is coming from the USA, and it's not really exploring like what is actually happening in the UK. It's really hard to find anything to support like clinical work as a speech therapist and supporting that kind of like cultural competency. And so I think, I don't know what your guys' experiences is, or if where you work you're like able to do like projects or research, but I do think like even going further than just having like resources, it would be great if we could get kind of more like projects on the ground to kind of collect these views and find out like what's missing and how we go forward.
Definitely.
Yeah.
I also think that this sort of a reflection of culture and community, even if you're living in a really white area, living and working in a really white area, is just important, like as a life skill, and just sort of navigating the world generally. You're obviously going to at some point interact with somebody from a different culture to your own, and I think tying on to what we were saying last week about it doesn't necessarily need to be like a 1-month course on every single culture and every single religion and every single background, but being given the space to develop that self-reflection skills, which will then transfer into a wider knowledge of sort of your place in the world and how that is different to others, and and your sort of interaction with like environment and community. So I think even if there was something that was developed for cultural competency training within the workplace, it would still be applicable everywhere.
I think even going further than that, I mean, this is slightly off our topic, but even thinking about social class and the difference within culture within that, if we think about health inequalities, a child, for example, that's from a middle class background, they'll be able to navigate the service a lot better than someone from a working class. So seeing how that affects therapy in itself, and because I was thinking of parents that don't speak English, for example, or don't understand the system, like how would they understand what their child's rights are in terms of therapy that they should be receiving, in terms of how the education healthcare plan works, and so on. And I think the same thing would apply for children that are from a working class background. And then it was probably very similar as well in adult therapies as well, sort of understanding what speech and language therapy is and why they're there. And that's the best way for you to get the most out of the service if you know what the therapist can provide. So thinking within that as well, even within white British patients.
Mm-hmm.
I think what we haven't really discussed yet is about the use of language and culture, not in terms of bilingualism, but actually about how different cultures use language, like as in interact with each other. So that comes under like language socialization, just in terms of how parents interact with their children and things like that. I mean, even if they're speaking English, just because they come from a different cultural background that uses language in a slightly different way, they're going to be communicating differently with their children than a white British English person will. Like we were discussing in previous podcasts about how white British people tend to do a lot of playing on the floor, but in other cultures, they won't be doing this so much. So if we say to them, you've got to do this as part of therapy. Parent-child interaction is obviously not going to work for a number of different cultural groups. So I think it's really important as well to, when we talk about cultural competency, also talk about this language socialization, because different cultures can use it so differently. I mean, there's one example. I was reading this study recently about a language group in Nigeria, and they actually don't use dyadic interaction. So, like in England, we might have like the parent talking directly to the baby or the young child. They use triadic interaction. So an adult may talk to the baby, but the baby's like on the mother's back, and the mother will answer for the baby. So they're not actually expecting the child to talk back at all to the adult. So there's just lots of different ways that different communities interact with each other, and I think it's really important to recognise that as well.
So I really want us to start thinking of sort of practical solutions of filling the gaps in our services, in our workplaces. How can we instigate projects and ideas to increase an environment of culturally aware practice as speech therapists? So if anybody has any personal experiences or maybe just ideas, then we can discuss that for the last 10 minutes.
Yeah, so I think thinking about I definitely went through a journey of feeling really like I'm a band 5, I've just qualified, what can I actually do in this situation? Because I'm not involved in hiring process, I'm not involved in creating policy, but then just actually taking a minute to reflect and think about what areas can I actually change or do something about. So I'm really lucky that in my trust, like I said, we do these projects and it can be about whatever we want to do. So I was just like, well, I'm going to do it about diversity and culture and about dysphagia management and end of life care. So I was really lucky in the sense that I could take ownership and make that into kind of whatever I wanted it to be. But I guess it's just thinking about, even in whatever position you're in, even if it's just something really small, like changing the way that you ask a question to a patient so they think about something different, or even what you guys said about saying, do you understand what speech therapy is before you start an assessment, even if it's something that little, just thinking and reflecting on yourself and thinking what is in my reach that I actually can change. And then even if it's just a little step first, it's better to go in that direction, if that kind of makes sense.
Yeah, definitely.
Because I don't know, I at the start I was kind of feeling this is massive. I feel especially in the area that I work in, and this isn't even my lived experience, so it's huge, and I was feeling very overwhelmed and I really want to do something meaningful, but actually just scaling it back a bit, but then just going for it was kind of helped me get my head around how I was going to do something meaningful.
That sounds really interesting, especially with end of life care, because I would imagine that varies massively within cultures. I remember when my gran was terminally ill, and the kind of things that they decided they would or they wouldn't do back in Algeria, I was like, what? You can't be it was just completely opposite, because I was so heavily influenced by British culture and what's acceptable, what's not. So yeah, that's really interesting.
It's interesting actually when you mentioned earlier about religion and things, because it's quite intertwined with end of life. Well, it's completely intertwined with end of life care as well as wider culture. But it was interesting speaking to lots of different people in my trust who were involved in that kind of process, and then thinking oh, we haven't really delved deep into that, or what that might mean for someone's preference for eating and drinking at the end of life or anything like that. But even just along the dysphagia kind of management, it's so interlinked to everything. So
yeah,
I mean, you're just about to start your job, Veronica. Congratulations. Maybe you can speak about what you'll be doing in your role that you think will make that sort of impact in terms of talking about diversity and culture.
Yeah, well, I think I am going to be working in a pretty white British area. So as a minority ethnic, religious minority person, then I will be obviously, I may be the only, BAME person there. So yeah, I'm definitely going to be using my influence to bring more kind of cultural competency into practice. And if there's any, I might suggest to do some training about certain things, especially around bilingualism and working with bilingual families, because that's my specialism. So yeah, I definitely think that I'm actually quite glad to be working now and to be working with an organization where I feel like I can kind of maybe make a difference. Although I will be a band 5, I feel like, even if you're a band 5, you can still make a difference. You just have to have the confidence to go in there and, tell people what you think, and tell people how to make the changes. Because as minority ethnic therapists, I think it probably has to come from us, because a lot of white British therapists might not have thought about it before. So yeah, I think if we just kind of go in and make a start, and then we get everyone else on board.
That's really interesting what you were just saying, and I think practical solutions, things like incorporating these things into peer supervision, management supervision, and like you said, I think sometimes it does need to come from us, and that's fine. It sometimes just to even open up the conversation, like if you're having a caseload review and you're talking about a child or an adult you're working with, sometimes just starting that conversation, okay, so these are the things that I've done to adapt my therapy and my resources, or this is what I did here. Like, can we share these ideas across the team? Because I think this would be really useful. So yeah, I think definitely reflection and always thinking about it. Like, it sounds like a lot, but always thinking about it with every person that you work with and having it at the forefront. As you would think about anything you'd be doing, getting your things sorted for your session. I think supervision is probably the most useful thing that I've found so far.
I think that like everybody said, that sometimes it does need to come from us, but I think like Sarah's a perfect example of how it doesn't need to be, and that everybody kind of has a role and responsibility and a opportunity to do it if they are interested in that. So I know a lot of like white speech therapists have reached out to us. What do we do? How do we start this without being insensitive or inappropriate or say something wrong? And I think that asking we speak about this a lot, and I think not being afraid to ask the questions, do the research, and getting that information out there, and supporting your fellow BAME therapists as well, because that's also really important, giving them a sort of safe space to discuss things. But yeah, again, like everybody kind of has a role and responsibility in it. It doesn't necessarily have to come from BAME therapists to make changes in that trust.
Definitely, yeah. And I think it's going back to that, is it cultural competence versus cultural humility? Because we're never going to be competent. It's something that we always have to work on and always learning about. And it's, again, going back to understanding our own assumptions and our own view of things, and our own biases and values, and how that might impact our therapy sessions, because we're also part of it. And sometimes it might not go to plan, and that's fine, because that's just a chance for us to learn of what went well, what didn't go well. And that goes back to reflective practice, which we do anyway, from session to session, and with working with different clients. So just learning from our experiences and then sharing ideas, I think, like Sarah said.
Going back to what you were saying about it not always having to come from kind of BAME therapist, and this conversation, or like initiating this conversations. And I do think from conversations that I've had with other speech therapists, there is that fear of like, am I going to say it wrong? Am I going to offend? But I think if we're going to make a change in this profession, like everyone needs to be part of this conversation. And speech therapists, we are nice people and like to think of ourselves as nice people, but also to continue that and be kind of and promote that, you have to start getting involved in the conversation and making those changes. And I think, you know, as you said, Miriam, like, it's not, oh, we're going to get things wrong, and like, you reflect on that and learn from it, and like, call yourself out on it as well. And like, it can be scary, but I think it's gone beyond the point where you have to kind of hold back, if that makes sense. Like, we all need to be part of this conversation now.
Yeah, definitely. We're going to end on that point, I think. Great. So thank you so much for that, everybody. Thank you, Sarah, for being here. It was really, really insightful. So that is the end of episode 6, and also the end of season 1. So we'll be taking a short break, and we'll be back in a couple of weeks with the beginning of our new season. And I think that our first season was a really great space to open up these conversations and give BAME therapists, especially, a platform to discuss their personal experiences. And now we're really hoping to move in the direction of practical changes, bringing in guest speakers who are really involved in the movement and who have got ideas and solutions to share, so that we can all, just like we were all saying, we all have a role in the anti-racism movement, into making our speech therapy more diverse. We also hope that we can use SLT time as a space to start collecting more research, personal experiences, feedback, reflection. So keep sending them in to us. They're really valuable, and we are collating them, and we're using them to sort of further all of our discussions and to really focus the topics that we're going to speak about in the future. So see you all in 2 weeks. Bye.
Bye.
Bye. Be sure to follow our Twitter and our Instagram,
SLT Time,
at SLT Time.
SLT Time, to keep up to date with new episode releases.
and that's the SLT for today.